When it starts to affect their growth and development, that's pretty much when it qualifies as an eating disorder. There are a lot of other variables associated with when we consider things to be an eating disorder. It depends on the age of the patient, other comorbidities of the patient. Of course, we have the DSM-4 criteria that clearly outline when you've meet criteria for an eating disorder, and usually it needs to be affecting not only your diet and not only your nutrition, but also it needs to be affecting other parts of your life. The key is that we really want to catch kids early on in an eating disorder. And the problem we have that's different from adults is that kids oftentimes don't meet DSM-4 criteria. And so we're having to look at how to catch them at an early phase, which is a lot more difficult than adults. So if we think about an eating disorder on a spectrum, that makes it a lot easier to catch kids at an early stage. Just like heart disease, blood pressure, cholesterol, there isn't a specific number where all of a sudden a child has an eating disorder and below that number they don't. It's on a spectrum, and so you can have mild cases and severe cases. The severe cases will probably meet criteria for DSM-4. So if you consider on one end of the spectrum, a perfectly healthy child would have intuitive eating, a positive self-body image, and on the far end of the spectrum, as far as severe eating disorders, you would have anorexia, bulimia, and eating disorder NOS. But there are several steps in the middle that if we catch on time will help us at least to be alert that this child is at risk for an eating disorder. So if you see a child dieting, if you see them dissatisfied with parts of their body, if you see them starting to compulsively exercise, if you see that they are getting obsessive about these things, as much as it may seem normal for the adult population to always be on a diet and to always want to exercise and talk about their fat tissue, in children this is really pathologic, and we need to be aware when this happens, and this really needs to raise a red flag that this may be the early stages of an eating disorder. So as a pediatrician, other than asking questions about how kids feel about food, how they feel about their weight and their growth, one of the biggest things I look at every single time they're there is their growth. And one important note to make is that a child that's losing weight who's supposed to be growing, that's never normal. And even a child who stays at the same weight and their BMI is dropping, that also is never normal. You either haven't found a pathologic problem or a true organic sickness, or that child has an eating disorder. So it's not just the kids that are losing weight, and it's not just the kids that are very skinny. As far as asking about red flags and behaviors, again, what seems normal in our society in children really should cause a lot of concern. So if they're counting calories, if they seem to have fear foods, a 5-year-old shouldn't tell you that they're afraid to eat trans fats, and an 8-year-old shouldn't tell you how many calories they eat in a day. And even a 10-year-old really shouldn't tell you that carbs are bad. So even if that seems like learned behavior from their parents or their friends, that's something that needs to be taken seriously in kids. So the final thing to think about when you're looking for kids that may have an early eating disorder is to really look at the history. So you need to know the family history. You need to know if one of the parents or one of the cousins had an eating disorder. And you also want to look at their, even back to their toddler history. If they had some type of feeding disorder, which may have been extreme pickiness or, decrease in appetite, not growing because of poor intake. Those are all things that make kids at risk for an eating disorder. So if you find a history that's concerning, in addition to any of those red flags in a child's behavior, that needs to be considered an early eating disorder.